So first of all, I would like to provide a brief overview of our primary health care surveys. Secondly, I would like to share with you some of our key observations, particularly for those of you who may be a little bit less familiar with our survey and this year's results. And thirdly, I would like to show you how to navigate the website to access the full sets of results. So why is this survey important? Primary healthcare is usually the first point of entry with the healthcare system. Therefore, it is important to have a good understanding of what is taking place in our communities, and this survey allows us to have a better understanding of the needs of the population, as well as the delivery of healthcare and the experience with the services. So, what is the reported health status of citizens? What is the percentage who report one or more chronic health condition? This survey is also an opportunity for citizens to express their opinions about the healthcare services they receive in New Brunswick. For instance, aim to better understand how do citizens use primary healthcare services, or what is their experience with the services they receive. Primary healthcare has been one of our key focus since the New Brunswick Health Council was created in 2008, and in 2011 we had a first iteration of the Primary Health Survey, a large population-based survey which collected data from around 14,000 participants and allowed us to report at the level of the 33 communities in New Brunswick. This survey was conducted on a 3-year cycle with surveys in 2011, 2014, 2017, and 2020. In 2022, we developed a shorter version of the survey that we called the Primary Care Survey. And this is the one I will be focusing on today. This survey is intended to become an annual survey, and we're currently preparing for the data collection that will start in October of this year. Both surveys follow a population-based random sampling approach, meaning that any resident of New Brunswick age 18 and over and living in a private household can be randomly selected by phone to participate in the survey with the option to complete the survey by phone or online. Basically, the main differences between this survey and the primary health survey are in terms of the scope. So the primary care surveys focus mostly on access, use, and experiences with primary healthcare services, and a bit less on social determinants of health or health behaviors. The sample size is different as well, because in order to be able to collect and analyze the data with a quicker turnaround and provide more timely data, we decided to reduce the sample size from 14,000 to 5,000. The reporting as well is a little bit different. So for this survey, we can report results at the provincial level and by the health zones. So this allows us to see if there are any differences depending on where someone lives. We also report results by demographic groups, for example, but not limited to age, immigration status, income, education, as well as for those who identify as indigenous. And this allows us to give an equity perspective based on the characteristics of the citizens. In order to be able to collect the data in 4 months, so we had to reduce the sample size for this cycle. So therefore, this time around, we're not able to report at the community level as we did before. In the 2022 edition, 5,013 citizens participated to the survey. As mentioned, the sample size allows us to provide a representative sample at the provincial level, at the health zone level, and for most demographic groups. In this survey, most of the questions are focused on 2 populations. The first one being citizens who have a primary care provider and had a consultation in the last 12 months, and the other groups are citizens without a primary care provider. So for both groups, we want to better understand how they use services and what was their experiences with the services they received. The survey also has questions about the health status of the citizens, their use of virtual care, and whether they faced any type of barriers when accessing care. You will see on our website that we divided our indicators into 6 main categories or data tables, as shown on the boxes on the screen. The first table regroups the indicators that have been deemed key for the cycle. The second table, Needs of New Brunswickers, looks at the self-reported health status such as perceived health, prevalence of chronic health conditions, and ability to manage one's conditions, as well as the needs for mental health and perceived mental unmet needs. The third table is about the access and barriers to healthcare services and overall experience with the healthcare services. Then we have two tables, one looking specifically at the use and experience of services for citizens with a provider, and another one for the use and experience of services for citizens without a primary care provider. And finally, the last table is about virtual care services, how citizens access virtual care, and their experience with using virtual care services. In this year's cycle, the key messages were taken to reflect on access, use, and experiences with services, and they are the following. So first of all, our first observation is that only 1 in 3 citizens who have a primary care provider was able to get an appointment within 5 days. Our second observation is that nearly 2 out of 3 citizens who have a primary care provider reported having to use at least one other healthcare services in the last 12 months due to the unavailability of their provider. The third observation is that 22% of citizens reported having trouble finding their way around the healthcare system, and that's an increase from 7.6% in 2020. Finally, our fourth key observation is that only 33% of citizens who have a chronic health conditions reported being very confident in their ability to manage their health condition, and that's down from 41% in 2020. And I will elaborate on some of these observations as I go through the website. So I will now move to the website to show you how to navigate it and by going through some of their key observations. So our website is nbhc.ca. So if you're looking for information about the primary care surveys, you can go under surveys and click on the primary health and primary care surveys. There you will see some general information about our two surveys on primary health care, as well as some publications related to our primary healthcare surveys results from this cycle and previous cycles. If you're interested in the most recent results from the primary care survey, you can go into the Primary Care Survey 2022 edition. And here you will see a brief article which includes our key observations for this edition. And you will see at the bottom of the page our 6 data tables. So I mentioned the first key observation for 2022, which is that only 1 in 3 citizens who have a primary care provider can get an appointment within 5 days. And we also showed that this proportion has been getting worse over time. Here in the visuals, we can see how this access has not only declined over time, but there is also a large geographic variability around timely access, with Zone 5 having the lowest percentage of citizens being able to see their provider within 5 days. So if I want to look at the results in more detail, I can click on this hyperlink, which will send me to the indicator page about being able to get an appointment with our family doctors within 5 days. Here we see the provincial results that can be interpreted as 34.1% of citizens who have a family doctor were able to get an appointment with their family doctor within 5 days. As we can see, this indicator was also measured in the larger primary healthcare surveys, so we are able to trend over time. We can see that the results have worsened over time, going here from 58.2% in 2014 to 34.1% in 2022. As you can see, these results are also available for all the different health zones, but in 2022, they are not available for the communities because of our smaller sample size. They are, however, available for the different characteristics. And you can see as well that this data can be exported using either a CSV or Excel format or in PDF. If I go back to the article, another of our observation was that despite having a primary care provider, a significant proportion of citizens are using other primary healthcare services. At the provincial level, we saw that 37% of citizens reported seeing a pharmacist, 27% used the emergency department, while 22% used an after-hours clinic. These results can vary a little bit depending on where citizens live, and in this graph, you can click on the arrows to see the different results for the different health zones. So for this observation, I will go to the data table directly to show you more about the navigation features of this data table. I will go to the data table Experience with Services with a primary care provider. As a side note, you can see that on this, for each table, you can always switch from one table to the other using the drop-down menu. So if I want to, and sorry, I forgot to mention that for each data table, we have a list of indicators that are divided into categories that are in red and subcategories that are highlighted in bold. So if I want to go the use of services in the last 12 months, which is this category, I can then go into the subcategory use of other healthcare services because the primary care provider was not available. I can browse through the different services that were used at the provincial level as well as for the different health zones. So if I go to the indicator, use one or more other healthcare services, I can click on it and then I'm able to see the full long name of this indicator. Again, we can compare the results by geographies as well as the different characteristics. As you will see, this indicator is only available in 2022 because it comes from a new question in our survey. For each indicator, you can also view the data using the chart or the map features. And if you want to learn more about the methodology, we have an About section that describes how each indicator was calculated and how to interpret them. Going back to the article, another one of our observation was we noticed this cycle an increase in the percentage of citizens who reported facing barriers in navigating the healthcare system. And as we can see in this visual, we see that this increase is visible for all 7 health zones. Again, this indicator can be found in our data tables, this time in our data table, access to healthcare services and barriers. So under the category barriers in accessing healthcare services in the last 12 months, I'm interested in the indicator trouble navigating the healthcare system. And here the result can be interpreted as 21.7% of citizens reported that they had trouble finding their way around the healthcare system in the last 12 months. Again, if I want to learn more about this indicator, I can click on it and I can look at the trend over time as well as see the results by each zones and the characteristics of the population. So for instance, for this indicator, Zone 3 has the highest percentage of citizens reporting these barriers at 26.3%. And we also observe that for some minority groups, this percentage is higher. So for instance, persons with a disability, citizens reported having a disabilities were 29.6% of these citizens reported having trouble finding their way around the healthcare system. As you can see, for each data point, we have confidence intervals, and I wanted to mention that they're always important to consider when comparing two results. As you may know, the smaller the sample size, the larger our confidence intervals and the margin of error. And so therefore the data should only be interpreted in light of this information. So just a side note for you when you're looking at the data for yourself. So in summary, our website allows us to have a look at the data, indicator by indicator, to be able to look at the geographic variability, the demographic variability, as well as the trends over time. And all of this helps us when we're trying to better understand the realities faced by different groups over time.